Clinical applications of ultrasound. When we are ready to select the parameters for ultrasound, we must determine the desired outcomes for certain factors, which will have an effect on the chosen parameters. These factors include the treatment area, the frequency of the treatment, the output frequency, the duty cycle, and the desired intensity. Before we can start treatment, we need to make sure that we are draping the patient with towels. Since we use gel as a medium with ultrasound, the treatment can be a little bit messy. Also, we use towels because we need to make sure that we are protecting our patients and our clients' dignity and appropriately draping them during treatment. We want to make sure that we're not exposing any area more than we absolutely have to perform our treatment. In addition, you need to check with the patient to make sure that they are in a comfortable position. As a clinician, you also need to be in a comfortable position because you may be there for a while performing the treatment, and it is best to be comfortable. Determining our treatment area. For thermal therapy, the size of the treatment area should be 2 to 3 times the effective radiating area of ultrasound. Remember that the ERA is smaller than the size of the ultrasound head and may be significantly smaller, but is used to determine the treatment size. Attempting to heat a larger area will significantly reduce the temperature increase in the target tissue. If we need to treat a larger area, we may need to break down the area into 2 or more treatment zones and perform multiple treatments. We can see an example of this on the quadriceps muscle. There would actually need to be approximately 3 treatments to treat the area of this size. When clinicians try to treat areas that are too large, it's commonly called washboarding. You have to cover a large amount of area, but the treatment does not have the physiological effects for either thermal or non-thermal treatment because the ultrasound head does not stay in one place for too long. It is not uncommon to see someone trying to treat an entire quadriceps or a back with one singular ultrasound treatment. The size of the treatment area for non-thermal treatments may be slightly larger, but there is no definitive guidelines that have been established. Our treatment area. While treating the target tissues, make sure to keep the head of the ultrasound moving so you don't burn the patient or create hot spots. Most commonly, a circular motion is chosen by the clinician to keep the ultrasound head moving. While it is important to keep the ultrasound head moving, we do not want to move it too fast or we will not get the desired treatment. The slower the movement, the better. We want to move the ultrasound head approximately 4 centimeters every second as our speed. We need to watch our patients and their reactions for potential hot spots that can be created by the beam non-uniformity ratio, or the BNR. Prior to treatment, we need to educate our patients that a burning feeling is not a normal sensation. Burning indicates that there is a potential for tissue damage. The patient should feel a slight warming of the tissues if it is a thermal treatment, but it should be comfortable during the entire treatment. The output frequency determines the depth of the target tissue of the treatment. 1 megahertz treatments have deeper effects, up to 6 centimeters. Some examples of structures which could be treated with a 1 megahertz treatment would be the rotator cuff and the vastus intermedialis, among other areas. 3 megahertz treatments have a superficial effect, only 2 to 3 centimeters. Some examples of structures which could be treated with a 3 megahertz treatment would be the patella tendon, Achilles tendon, and the ulnar collateral ligament at the elbow, among other areas. It is important to remember that adipose tissue is transparent to ultrasound, so patients with higher amounts of body fat are less affected by this deeper form of heat than they are by superficial heating protocols. The desired effects of thermal or continuous ultrasound should be specified temperature increases. Thermal ultrasound is used in order to bring about certain therapeutic effects, and tissues respond accordingly to the amount of heat that they receive. Therefore, any significant adjustment in the intensity should be countered with an adjustment in the treatment time. For a temperature increase of 1.8 degrees Fahrenheit or 1 degree Celsius, this results in mild heating. The overall effect would be an increase in metabolism and a reduced mild inflammation. For a temperature increase of 3.6 to 5.4 degrees Fahrenheit or 2 to 3 degrees Celsius, it will result in moderate heating. The overall effect would be a pain reduction and decreased muscle spasms, as well as an increase in blood flow. For a temperature increase of 7.2 degrees Fahrenheit or 4 degrees Celsius would result in vigorous heating. The overall effect would be an increase in range of motion and tissue extensibility. Vigorous heating is more effective when it is combined with stretch and mobilization. If the intensity is reduced, treatment time should be increased. The treatment duration in a typical clinical setting ranges from 5 to 10 minutes, but a clinician really needs to examine multiple factors to determine the amount of treatment time necessary to affect target tissues. It is important to examine the size of the area, the tissues we are targeting, and the intensity of the treatment protocol. We also have to determine the desired effects, whether the treatment outcome should be thermal or non-thermal outcomes. This chart of the rate of ultrasound heating is very important, and you will need to know how to use this chart to determine treatment times for thermal ultrasound treatment. If you're looking in the Starkey text, the chart can be located on page 195 in the Starkey text and on page 264 in the Knight and Draper text if you're using that. You do not have to memorize this chart, but you do need to know how to use this chart to make calculations towards treatment times. If our goal was to use thermal ultrasound to increase tissue temperature by 1 degree Celsius, which is very mild heating, we could use different treatment parameters. If we choose an intensity of 1 watt per centimeter squared, we could also choose a 1 megahertz treatment protocol, which is a deep treatment of tissues. If we were targeting a tissue depth of approximately 6 centimeters, if we use the chart, we can see that for every minute of treatment, there will be an increase in tissue temperature of 0.2 degrees Celsius. Our original goal was a 1 degree tissue temperature increase. We could do the math to determine how much treatment time we would need. If we divide the 1 degree tissue temperature change by the 0.2 degrees Celsius of temperature increase per minute, we can calculate our treatment time of 5 minutes. If our goal was to use thermal ultrasound to increase tissue temperature by 3.0 or 4.0 degrees Celsius, which is considered a vigorous heating and might be used for increasing tissue extensibility, we could use this table again. If we state with the intensity of 1.0 watts per centimeter squared, this time we could choose a 3 megahertz treatment protocol, which is more superficial treatment of tissues, approximately 2 to 3 centimeters deep. We can see that for every minute of treatment, there would be an increase in tissue temperature of 0.6 degrees Celsius. Our goal was vigorous treatment of tissue, an increase of 3 to 4 degrees Celsius. Again, we could do the math to determine how much treatment time we would need. If we chose the 3 degree temperature change, we can divide the 3 degree tissue temperature change by the 0.6 degrees Celsius of temperature increase per minute, and we can calculate our treatment time of 5 minutes. If we are to increase our treatment time by 1 minute to a 6-minute total treatment time, the temperature increase for the target tissue would be 3.6 degrees Celsius, which is between the 3 and 4-degree tissue temperature range. Our duty cycle. We must also choose the duty cycle as either pulsed or continuous treatment. Remember that continuous treatment is on 100% of the time. The intensity remains constant over time, and there is a thermal effect because the machine is on constantly. This treatment is great for treating chronic injuries or for increasing range of motion. Pulsed ultrasound occurs when there is some time off, which means the machine is on less than 100% of the time. The intensity is interrupted. We can use smaller duty cycles, such as 10 or 20%, for non-thermal treatments. We may even be able to use ultrasound for its non-thermal effects on an acute ankle sprain if we choose a very small duty cycle. As the duty cycle increases, so does the amount of thermal treatment that is applied to the tissues. At a 50% duty cycle, we would most likely treat subacute injuries. We also need to consider the coupling methods. Attempting to pass ultrasound through a non-conductive medium can damage the crystal. Most ultrasound generators automatically shut down an application if it is attempted without a medium. If an unacceptable medium is used, or if sufficient contact is not made with the skin, the machine will shut down. Do not attempt to increase the output intensity without the transducer being in contact with the individual skin. Without a medium, we damage the crystal, which is very important for our machine to work properly. There are several different coupling methods that we can utilize. One of the most common coupling methods is direct coupling. In this method of ultrasound application, the transducer is applied directly to the skin, with an approved gel used to transfer the energy to the ultrasound head and the skin. This is a good treatment for relatively flat areas so that the energy strikes the tissues at a 90-degree angle. Angles less than 80 degrees significantly reduce the effectiveness of treatment. We apply gel liberally to the body part. We want to use a firm, consistent pressure to hold the sound head in contact with the skin. Too little pressure creates an insufficient couple. Too much pressure decreases the amount of energy transferred to the tissues by scraping off the transmission medium, and the pressure may cause the patient discomfort. I would encourage you to keep the ultrasound transmission gel bottle available to add more transmission gel during the treatment. Many clinicians like to scoop the gel as it moves out of the treatment parameters, which then widens the treatment area and decreases our effectiveness of ultrasound. With extra gel, you can add it to the current treatment area and maintain the effect of ultrasound. A good medium must transmit significant percentages of the ultrasound. Therefore, it should be non-reflective. The optimal medium for transmission is distilled water, which reflects only 0.2% of the energy. We can see by this chart that ultrasound transmission gel is 96% efficient in the transmission relative to the distilled water. A secondary option would be ultrasound transmission lotion, which is only 90% efficient in the transmission of ultrasound energy relative to the distilled water. Not all substances efficiently transfer the ultrasonic energy from the transducer to the tissues, and many block energy altogether. Topical counter-irritants and analgesics have been used as a coupling agent, but these products can decrease the effectiveness of the treatment or altogether render the treatment ineffective. Here are some examples of good mediums on the left and poor mediums on the right. Another coupling method is an immersion technique. When treating irregularly shaped areas such as the distal extremities or the hands, A more uniform dose of ultrasound is delivered using water as a transmission medium. The body part is immersed in a tub of water. The water should be degassed if possible. Water can be degassed by first boiling it for 30 to 45 minutes and then storing it in an airtight container. Either sterile or distilled water may be used as well. The clinician needs to watch out for air bubbles. The air bubbles will tend to form along the patient's skin and may interfere with the transmission of ultrasound. Wisp away any bubbles that form on the patient's skin or on the transducer head before or during the treatment. Place the transducer in the water with the sound head approximately ½ inch to 1 inch away from the target tissues. The face of the transducer should be parallel with the surface of the skin so that the energy strikes the tissue at a 90-degree angle. If non-distilled water is being used, the intensity of the ultrasound can be increased by approximately 0.5 watts per square centimeter. A ceramic or a metal tub is recommended for underwater ultrasound application. The reflective surfaces create an echo chamber that allows the sound waves to strike the body part from all angles. Plastic tubs are not recommended because they absorb ultrasonic energy. As a coupling technique, the immersion technique is not often utilized because of several issues. First, practicality. It is difficult to set up the proper parameters, such as finding a ceramic or metal object in which to submerge the patient. Second, degassing the water. Boiling the water for 30 to 45 minutes and then storing it in an airtight container for 4 to 24 hours takes a lot of planning and time on the clinician's part. There has been some research that suggests that this coupling method may be a lot less effective. In older studies, they have suggested that immersion ultrasound fails to increase the tissue temperature to a therapeutic level. Unfortunately, there have not been a lot of newer studies that have disproved this research or suggested it is more effective. Another coupling method is a pad or a bladder as a transmission medium. This technique originally used a balloon, condom, or plastic-filled bag with water or ultrasound transmission gel that was coated with a coupling agent. The bladder is able to conform to irregularly shaped areas, which makes it very versatile in its use. The disadvantage is the formation of air pockets within the bladder that prohibit the transmission of sound waves and the difficulty of holding the gel-coated bladder in place during a treatment. We would need to apply a transmission medium to the skin and to the outer surface of the bladder for it to be effective. The bladder is then held against the body part while the sound applicator is moved over its surface. Commercially produced gel pads have become popular and effective alternatives to the bladder method. Gel pads are formed from ultrasound gel in a tight matrix, which allows them to hold their shape while being conformed to the contours of the body. Gel pads also limit the treatment area size selected, thus focusing the energy on an area approximately the size of the sound head. We would need to apply a transmission medium to the skin and to the outer surface of the gel pad, and then move the sound head over the gel pad for treatment. The research has suggested that a 1 centimeter thick gel pad is more effective in producing therapeutic effects than are the 2 centimeter pads, but they are both more effective than the immersion technique. Phonophoresis is the use of ultrasound or acoustical energy to help move a topical medium into tissues. The theory is that ultrasound enhances transdermal drug delivery by dilating hair follicles and sweat glands, and increasing circulation and kinetic energy of the local cells. The thermal effects of ultrasound increase the kinetic energy of both the local cells and the medication. dilating the points of entry such as the hair follicles or sweat glands, which increases the circulation, increasing capillary permeability, and distorting the structured lipids in the stratum corneum. Phonophoresis is applied by mixing the medication, which is usually a topical cream, with ultrasound gel and then applying the ultrasound head to the gel just like a normal ultrasound delivery. Ultrasound will result in what's called sonoporation, in which the sound waves increase the cell membrane permeability, thereby facilitating the delivery of the molecules to precise locations in the body. The successful delivery of medications is limited by the inability of the molecules to cross biological barriers, like the cell membrane. An advantage of phonophoresis is that medication can be delivered via safe, painless, and non-invasive techniques. The effects of phonophoresis in utilizing thermal ultrasound include dilated points of entry, increased circulation, and capillary permeability. The effects of phonophoresis in utilizing non-thermal ultrasound include increased cell permeability and the permeability of molecules. Phonophoresis and iontophoresis are similar. Iontophoresis will be covered in the electrical modality module. Iontophoresis uses an electrical current to repel an ionized medication during treatment. Phonophoresis uses ultrasound to move medication across the skin barrier to target tissues. As far as a comparison, both methods utilize medication in their application. However, the mode of delivery is very different. In phonophoresis, the medication is moved via diffusion, which means that the medication will seep into the skin as a byproduct of the application of the acoustical energy and its influence on increasing cell membrane permeability, rather than medication being pushed across the skin via electrical energy, such as in iontophoresis. Here's an example of how iontophoresis works. We have a medication which has a positive or negative charge. We then use iontophoresis by using the same type of charge to push or repel the medication across the skin via electrical energy. We can then see the medication being repelled and pushed into the skin. On the opposite side, phonophoresis, we have our application of our ultrasound above the tissues. We use ultrasound energy to allow the medication to seep into the skin to targeted tissues. The benefits of both ionto and phonophoresis are similar as well. The primary benefits to utilizing iontophoresis include local, non-invasive treatment of target tissues. The medication does not need to go through the systemic system, including the stomach, intestines, and bloodstream to target tissues. In addition, the skin is not broken, such as with a needle stick to administer medication. Unfortunately, iontophoresis often causes skin irritation, especially in individuals with lighter skin pigmentation. We can target tissues at a depth of approximately 6 to 20 millimeters during treatment. One additional benefit to utilizing iontophoresis includes the fact that as a clinician, we can set the parameters of the machine and can essentially walk away during the treatment. The primary benefit to using phonophoresis include local and systemic, and it is non-invasive. The medication does not need to go through the systemic system, including the stomach, intestines, and bloodstream, to target tissues. However, since phonophoresis is less targeted than iontophoresis, it may also have an effect on the systemic functions as a side effect. In addition, the skin is not broken, such as with a needle, to administer the medication. Phonophoresis is less likely to cause skin irritation. The target tissues can be reached up to 6 centimeters, which is a much greater depth than iontophoresis. However, the therapist must be present during the application to perform the ultrasound and phonophoresis treatment for the patient. Many factors affect the use of phonophoresis. These factors include the hydration level of the patient. The higher the water content, the more permeable the skin is to the passage of medications. The age of the patient. Dehydration occurs as skin ages. Circulation and lipid content also decrease. The body composition of the patient. The easiest passage of medication through the skin is near hair follicles, sebaceous glands, and sweat ducts. Although hair follicles encourage the passage of medication through the skin, excessive hair should be shaved off the area being treated. The vascularity of the target tissue. Highly vascular areas are more apt to allow for the transfer of medication into deep tissues. Constricted vessels localize the effects, where dilated vessels enhance the systemic delivery of medication. The skin thickness of the treatment area. Thick skin presents a much more cumbersome barrier to medication than does thinner skin. When applying phonophoresis to an area, attempt to administer it over areas of low skin density. For example, when treating an individual suffering from plantar fasciitis, apply the medication to the medial-inferior aspect of the calcaneus rather than on its plantar surface. For treating orthopedic injuries, the most commonly used medications in phonophoresis are either anti-inflammatories, such as cortisol, hydrocortisone, salicates or dexamethasone, or analgesics such as lidocaine. Preheating the treatment area with a moist hot pack to increase local blood flow and kinetic energy can further enhance the delivery of the medication. The moist heat also hydrates the stratum corneum, which will assist with the transfer of ultrasound through the skin and aids in the diffusion of medication across the skin barrier. Another strategy to increase the effectiveness of phonophoresis includes applying the medication to the skin, massaging the medication into the skin, but be sure to wear a glove if you are the clinician, so you are not receiving the effects of the medication as well. And then performing ultrasound on top of the massaged medication. Or you could apply an occlusive dressing after the treatment in the hopes of holding the medication into the skin longer for further transmission. The application of phonophoresis should include the following steps. First, preheat the area with a moist heat pack for approximately 20 minutes. Then use a direct coupling method for the ultrasound treatment. Ensure that the skin is well moistened prior to treatment. Use appropriate medication only. Phonophoresis is the use of prescription medications which are regulated by most state pharmacy practice acts. Although there is a variation from state to state, the law may require that the medication be specifically prescribed to an individual patient. Use continuous ultrasound settings unless thermal effects are contraindicated, such as those of an acute injury. After treatment, cover the remaining medication with an occlusive dressing. Unfortunately, the efficacy of phonophoresis has not been fully substantiated. Many research articles have suggested that there is very little evidence that suggests that the medication actually reaches the target tissue. Some new research has been conducted utilizing low-frequency ultrasounds of 20 kHz on animals. The 20 kHz ultrasound increased the skin permeability 1,000-fold over that of 1 MHz ultrasound, and therefore the ultrasound frequencies commonly used for therapeutic purposes on humans may be too high of a frequency to be effective for phonophoresis. The use of ultrasound and electrical therapy techniques are known as combination therapy. When the combination therapy is used, the ultrasound head acts as an electrode. In this setup, the electrode from the stimulation unit acts as a dispersive, and the ultrasound head acts as an active probe. The muscle will be stimulated to contract, but there will be little, if any, heating that occurs. The electrical stimulation causes analgesia and muscle contraction. Combo is commonly utilized to treat myofascial trigger points. The common settings for the use of trigger points or motor points include: the ultrasound frequency should be set dependent upon the target depth of tissue, either deep with 1 MHz or superficial with 3 MHz. The ultrasound intensity is commonly set between 1.0 and 1.5 watts per centimeter squared. The E-stem intensity should be set for a motor contraction. The treatment duration is between 5 and 10 minutes. The idea behind this treatment is that we have a thermal ultrasound treatment combined with motor level electrical stimulation. Here's a picture of what a combo treatment or combination therapy treatment looks like on an upper back. Some of the controversies with the use of ultrasound therapy frequently stem from therapist error, which leads to ineffective treatment for patients. Some common mistakes include trying to treat too large of an area, having a speedy sound head. Remember that the sound head should move slowly. What's the speed limit? That's right, the sound head should move at a speed of 4 centimeters a second. Having too short of a treatment time. Remember to utilize the chart to determine our treatment time parameters. Using the wrong frequency, either superficial versus deep. We have to have a solid foundation of the underlying anatomy in order to determine the target tissue and select the proper parameters. Misuse of coupling mediums. Remember that some mediums are better conductors of sound waves than are others. Ultrasound gel or distilled or degassed water are the best coupling mediums. And the wrong treatment angle for the ultrasound head. The ultrasound head works best at a 90-degree angle. Anything less than 80 degrees will result in a lot of refraction of the ultrasound waves. As a clinician, remember to do your best and make sure that your patient is comfortable. Do not feel bad if your patient reports discomfort. Modify the treatment and try different things. Also remember that it may not be you. It could be due to the quality of the crystal. The better the quality of the crystal and the lower the BNR, the less hot spots and patient discomfort. Sometimes we are limited by the technology we have available to us. We need to make adjustments such as speeding up the movement or lowering the intensity, which ideally would result in a greater treatment time to make the patient more comfortable during the treatment.